All right, let's dive in. Today, we're taking a bit of a guided tour through a really important topic, colorectal cancer. And we're going to find out why, in this particular disease, a tumor's address can be way more important than its size. So let's get started.
First up, just to put this all in perspective, you gotta know this number. Colorectal cancer is the #2 cause of all cancer deaths. It's a huge deal, which is exactly why understanding the ins and outs is so critical.
And that really brings us to the big question for today. We usually think bigger is always worse when it comes to cancer, right? But here it's all about location, location, location. And that one idea might just change how you think about this whole disease. Okay, so to get why location is everything, we need a map. So let's take a real quick anatomical tour of the final stretch of our digestive system. Our tour starts at a super specific landmark, the S3 vertebrae, way down in your lower back. This is the exact point where the sigmoid colon ends. It kind of sheds its outer layer of support, and bam, it officially becomes the rectum. It's a very clear handoff. So look, the path is really short, but it's absolutely crucial. From that S3 vertebra, you've got about 15 centimeters of rectum. Then the rectum turns into the anus, which is, the final exit. And that tiny little stretch of highway, that's the entire neighborhood we're exploring today. Okay, so now that we've got our map, let's introduce the main character here. What's so wild is that this cancer basically has two completely different personalities, and which one you meet depends entirely on where it decides to set up shop. But before we get to those two personalities, you should know that we're almost always talking about one specific type of cancer. A whopping 98% of colorectal cancers are something called adenocarcinoma. And that's actually a good thing because it means doctors can really zero in on their approach. And boom, here are those two personalities in action. Cancers on the right side of the colon, where everything is a bit more liquid, they tend to bleed. A patient might not even notice anything wrong, but they'll show up to the doctor with anemia. But cancers on the left side, closer to the exit, they tend to block things up. They literally obstruct the passage of stool, which causes a totally different set of problems. You know what's really interesting? There's a buzzword that doctors use for that obstruction. When they see it on an X-ray, that left-sided tumor squeezing the colon, it looks just like an apple that's been eaten down to the core. So they call it an apple core lesion. It's just their shorthand for a blockage. Now, when colon cancer decides it wants to travel, metastasize, it has a favorite vacation spot, the liver. And on those imaging scans, these liver metastases have this really distinct kind of ominous look to them that doctors call evil gray. So that's what happens when the cancer travels far. But even before it gets a chance to do that, how it spreads locally is just as important. So let's zoom in specifically on rectal cancer now, because there is one single factor in the diagnosis that changes absolutely everything for the patient. To get this, we just need a quick word on staging. Staging is really just the system doctors use to describe how far a cancer has gone. For rectal cancer, the part that matters most is the T stage. That T just tells us how much the main tumor itself has grown. And here's the kicker. While there are a few different T stages, there is one specific stage that acts like a massive dividing line. If a tumor crosses this line, the entire treatment plan gets flipped on its head. So here's the progression. Pay attention. In the T1 or T2 stage, the tumor is nicely contained inside the wall of the rectum. But at the T3 stage, it breaks through that wall. It invades the fat that surrounds the rectum, and that is the game changer. Once a tumor hits T3, the patient is almost always going to get chemotherapy and radiation before surgery, not after. It's a total shift in strategy. And this whole location is everything theme, it doesn't stop after the diagnosis. It actually dictates the exact type of surgery a patient is going to get. And believe it or not, it all boils down to this one number, 5 centimeters. A tumor's distance from what's called the anal rectal angle, basically how close it is to the exit, that's the dividing line. If it's more than 5 centimeters away, it's called a high tumor. If it's closer, it's low. And that one little measurement determines the whole surgical game plan. But whether the surgery is for a high or a low tumor, the main goal is always the same. It's called a total mesorectal excision. The best way to think about it is, they're not just removing the tumor. They're removing its entire local support system. All the nearby lymph nodes, all the tissue, the blood supply, all in one clean package. It just gives the patient the best possible shot. So we've been focused on cancer, but it's actually not the only thing that can grow down there. To round out our tour, let's look at another type of growth, one that isn't even cancerous, but believe me, can be just as dramatic. I want you to meet the villous adenoma. Now, this is a benign tumor, which means non-cancerous. But please, do not let that word benign fool you. This little growth can cause some of the most intense, severe symptoms a doctor will ever come across. So what this benign tumor does is kind of wild. It starts secreting just insane amounts of mucus, which leads to this really profound diarrhea. And we're not just talking about discomfort here. This can cause life-threatening dehydration and a massive drop in the body's essential electrolytes. You know, the salts like sodium and potassium that your body literally needs to function. And this quote from the source material just paints the perfect clinical picture. The classic textbook case is an elderly woman who shows up with terrible diarrhea, and her blood work is a total mess. It shows hyponatremia, which is dangerously low sodium, and hypokalemia, dangerously low potassium. And what's the cause? A benign mass they find in the rectum. It's just a powerful reminder that not all danger is cancer.
So, as we wrap up our tour, what are the big things to remember? Well, first, that colorectal cancer is a major, major health problem. We've learned its symptoms totally depend on its address. Right-sided tumors bleed, left-sided tumors block. We've seen how for rectal cancer, hitting that T3 stage is the huge turning point that changes the whole treatment plan. And finally, we saw that even tumors that aren't cancer can cause big, big trouble.
And that leads us with one last thing to think about. If a tumor's symptoms, its treatment, and even the surgery all hinge so heavily on its exact location, well, how does that change the way we should be thinking about screening and just how important early, precise detection really is? It is truly a cancer where millimeters matter. Thanks so much for watching.